Hi, I'm Naomi Rader, a Minnesota licensed Medicare broker. My husband Eric and I live on a hobby farm with our four kids who keep us plenty busy. I enjoy gardening, cooking, hiking, and adventuring. I have worked in the service industry for most of my adult life, so when the opportunity presented itself, I knew this would be a good fit. I love talking to people, teaching them about Medicare, and helping them through this process. In this presentation, we will discuss who is eligible for Medicare, the different parts of Medicare, and much more. If you have any questions, I'd be so happy to help you answer those. Let's get started. What is Medicare and who is eligible for it? Medicare is a federal insurance program for people 65 or older, people under 65 with disabilities, end-stage renal disease, or Lou Gehrig's disease. Medicare is divided up into different parts, parts A, B, C, and D. You might be wondering what they all mean and why some people call Medicare alphabet soup. Medicare's Parts A and B is what we call Original Medicare. You get Medicare Parts A and B through Social Security. Then you put a plan on top of that to give better coverage and an out-of-pocket max, which will protect you from bankruptcy. Your options would be Part C or an Advantage plan, a Medigap or a supplement plan, or a cost plan if you're eligible. Medicare Part A is $0 as long as you've worked 40 quarters or 10 years. Medicare Part A covers inpatient hospital care, skilled nursing, home health, and hospice, but only up to a certain amount. If you get admitted into the hospital, days 1 through 60 would be a $1,676 deductible for each benefit period. Days 61 through 90 would be a $419 copay per day. You get 60 lifetime reserve days at $838 each. Anything above and beyond that, you'd pay all costs with no max out of pocket. This is a perfect example as to why you would want to put one of the private plans on top of your Medicare A and B to give yourself a max out of pocket so you don't go bankrupt. Part A also covers some skilled nursing care. You must stay 3 overnights in the hospital to qualify. Days 1 through 20, there's a $0 copay. Days 21 through 100, $209.50 per day. But above and beyond that, you'd pay all costs. Medicare plans generally don't cover anything over 100 days. That would be more like a long-term care policy that would give you more extended coverage in a care facility. Medicare Part A also does some home health care for a $0 copay. It's generally for someone with physical therapy or who is homebound and unable to take themselves to the clinic. It has to be approved by a doctor and medically necessary. Again, it's only part-time or intermediate. It does not cover long-term care. Hospice is also covered under Part A. It's generally a $0 copay. You get your doctors and nursing through hospice, and at that time, you would no longer need Part B coverage. Medicare Part B is usually $185 for the average American in 2025, but depending on your income, you could pay more or less. Part B covers your doctor visits, labs, tests, procedures, same-day surgery, hospital observation, mental health, ambulance, air or ground, medical equipment such as walkers, blood sugar monitors, and CPAPs. It does need to be medically necessary in order for Medicare to cover those things. Part B would also have an annual deductible of $257 with an 80-20 split. Medicare pays 80% and you pay 20% with no max out of pocket. Part B also covers preventatives. As I said, Medicare Part B covers preventatives. Everyone will get this book in the mail called Medicare and You. It's just a really good resource. Anytime you see a blue apple in this book, that's a preventative on Medicare and they will cover it 100%. Just be aware, annual physical is not a preventative on Medicare. So depending on the plan you choose, you may not have an annual physical covered. The book also comes in an app called What's Covered. There is a search toolbar that might be a little easier and quicker to search for what you're looking for. In the previous slide, I said depending on your income, you may pay more or less for Part B. The reason for that is Social Security uses IRMA, an income-related monthly adjustment amount. The more you make, the more you pay. For example, if you're filing as an individual and make 106 or less, you will pay the 185 amount. Or if you're filing jointly and make 212,000 or less, you will pay 185 as well. If you look at the chart on the screen, you will see that the more you make, the more you pay. But that's not all. IRMA goes off your income from 2 years prior. So in 2025, they're looking at your tax return from 2023. We also like for people to be aware what happens if you're retiring with a big lump sum or pension. Depending on when you took the lump sum, you could be paying more because of it. Also, if you have a traditional IRA and want to convert it to a Roth IRA, that becomes a taxable event. And depending on how much that event was, you could also pay more because of it. Medicare Part B does have a late enrollment penalty of 10% every year you went without either Medicare or credible coverage past the age of 65 or when you became eligible for Medicare. So I have an example over here. Our friend Joe retired at age 64. He realized he wanted to sign up for Medicare at age 68. He had to wait until the enrollment period in January. So our friend Joe went 3 years without Medicare or credible coverage. With his Part B being 185, we would take that times 10%, giving us a yearly penalty of $18.50. Now we take the $18.50 and times that by 3 for the 3 years he went without coverage. Our friend Joe has $55.50 monthly penalty. This penalty will increase over time and it is lifelong. We are going to skip ahead to Medicare Part D. Medicare Part D is your drug prescription coverage. Private insurance companies run drug plans. Drug plans are determined by formularies, tiers, networks, and copays. In 2025, the Inflation Reduction Act put a yearly cap of $2,000 on medications, whereas the previous year of 2024, there was an $8,000 cap on medications. And just like Part B, Part D also has IRMA, income-related monthly adjustment amount. If you are someone filing individually and making $106,000 or less, you will pay your plan premium. And if you're someone filing jointly making $212,000 or less, you will pay your plan premium. If you look at the chart, the more you make, the more you could pay for your Part D plan. And also, like Part B, it goes off your income from 2 years prior. In 2025, they will look at your 2023 income. And also like Part B, Part D also has a penalty. Part D penalty is 1% every month you went without a credible drug plan past 65. So for the penalty, they look at average drug plan prices for 2025, which is $36.78. Times that by 1%. If you round up, it's 37 cents a month. So if we look at our friend Joe again, who retired when he was 64 but didn't get a credible drug plan until past the age of 68, he went 3 years and 2 months without a credible drug plan, which is 38 months total. Now he has a $13.98 a month penalty. On top of that, $55.50 a month penalty from Part B. This will also increase over time and be lifelong. Don't be like our friend Joe and get penalized. If you are someone with low income, I recommend reaching out to your local county. There are multiple different programs that you could apply to. Some of the different programs could pay for your Part B premium, help pay for your medications, or apply for medical assistance. They all start when your assets are under $10,000 for a single person or $18,000 for a couple. This includes all money in the bank and retirement accounts. They don't count one house or one car. There are 3 different plan options: Medicare Part C, also known as Medicare Advantage Plan, Medicare Supplement, also known as a Medigap, or a cost plan. Cost plans are being phased out and are only offered in a select few counties. Counties around our current location are Goodhue and Rice County. Medicare Part C, also known as a Medicare Advantage, takes your Medicare A and B and D, which is your drug prescription plan, and combines it into one. Advantage plans are offered by private companies that are contracted by the federal government but vary by the county you live in. Advantage plans have networks, copays, a max out-of-pocket limit, and they may include additional benefits like dental, gym, hearing, vision, and an annual physical. Inside of the Advantage plan can change each year. Medicare supplements, also known as Medigap, are more comprehensive and standardized in the state of Minnesota. There are four main options for supplements in the state: the basic, the copay, extended basic, or high deductible plan. You may hear some people refer to supplements with other letters, like Plan G or N, but usually in the state of Minnesota, we don't refer to them by letters. Medicare supplements are state-run and have underwriting guidelines, which means you may have to take a health questionnaire in order to qualify. In your first 6 months of being on Part B, you are auto-qualified into a supplement with no underwriting. If you try to apply for a supplement 6 months after being on Part B, you would then have to do a health questionnaire. They could pull your medical records and could deny you. The nice thing about supplements is usually you don't have a network. You can go anywhere as long as the provider accepts Medicare. You usually can keep this plan if you move. Your drug plan would be separate, and the inside of this plan does not change. Medicare cost plans are a unique type of Medicare Advantage. I look at them as a hybrid between an Advantage plan and a supplement. With cost plans, you can usually go anywhere Medicare is accepted. They may or may not include a drug plan. If the drug plan is separate, you can change your medical plan every month. They have copays. They give you a max out-of-pocket limit. They can include dental, gym, hearing, and vision. This plan can change each year. And again, cost plans are getting phased out and are only offered in a select few counties in Minnesota. Now that we have learned all about the different parts of Medicare and the plans, when does it all start? Well, you can have your Medicare begin on the first day of your birth month. It doesn't matter if your birthday is on the 3rd, the 12th, or the 24th. It'll always start on the first day of your birth month or 2 years after your disability. There is an exception if your birthday falls on the first day of the month. Your Medicare will start the month prior. You may also delay Medicare as long as you have credible coverage. Applying for your Medicare A and B is the first step of the process. But when and how do you apply? Well, if you're receiving a Social Security check 4 months before you turn 65, Social Security will automatically enroll you in Parts A and B. If you choose to delay your Part B, you will want to inform Social Security. If you are not receiving a Social Security check and you would like your Medicare Part A and B to start at age 65, you are in what's called your initial enrollment period. Your initial enrollment period is 7 months surrounding your 65th birthday, 3 months prior to your birthday, the birth month, and 3 months after your 65th birthday. If you want your plan to start the first of your birth month, I always recommend starting the process as soon as possible. It can take Social Security 30 to 60 days to process the application. For example, if your birthday is in March, you can start the process in December. Your Medicare Part B premium also comes out of your Social Security check. If you are not collecting a Social Security check and are planning on delaying your Social Security payments, Social Security will bill you quarterly for your Part B premium. If you are working past 65 or plan on delaying your Medicare Part B, you will want to ensure that you have credible coverage. Usually the rule of thumb for credible coverage is as long as the employer has over 20 employees and it's a group covered defined by the IRS. You also want to make sure that you have credible drug coverage as well. There's no penalty for delaying as long as you have credible coverage. Some people, however, do apply for Medicare Part A only, since Medicare Part A is $0 and it will put you in the Medicare system. When you apply for B down the road, it may go smoother. If you are wanting to apply for Medicare A and B, or just B, past 65, there's a special form that will need to be filled out to prove that you've had credible coverage. You can get the form from Social Security, or I have it in my office. You can submit this form up to 3 months prior to when you want your A and B to start. Again, I suggest the sooner the better because it can take 30 to 60 days for them to process the request. You will be in what's called your special enrollment period, which is 63 days after you plan on retiring or losing your credible coverage. Sometimes, when you work past 65, we suggest coming in for a no-cost consultation to see if Medicare could be cheaper than your employer plan. About 50% of the time, Medicare can be cheaper than your employer plan. You can keep working but have Medicare as a health insurance coverage. If you are someone who is getting TRICARE, CHAMP VA, or retiree coverage, usually Medicare becomes your primary. If you are someone who has a sharing plan or a traditional individual or family insurance, like MinSure, for example, they usually will terminate you at age 65. Typically, Medicare costs less than COBRA coverage, and COBRA coverage isn't considered credible coverage. You could also get penalties. I suggest talking with your advisor through these scenarios. Also, if you are someone who has a high deductible health savings account, also known as an HSA, you may want to delay Medicare until you retire. But I would also suggest to stop contributing to your HSA 6 months before going on Medicare. You could have tax penalties if you don't do so. So, how do you choose which plan is right for you? You'll want to look at your network and decide which doctors, clinics, and hospitals you'll need. For your drug plan, you will want to make sure all of your drugs are in the drug plan formulary. You'll also want to look at your portability. How often do you travel? When do you travel? How long is the duration of your stay? Do you need to have access to out-of-state doctors for routine visits while traveling? You're going to want to look at your costs. What is your budget? Are you willing to pay a higher premium for a lower copay? Or do you want to pay a low premium with higher copays? This is something a licensed Medicare broker can help you navigate. So to review, your first step would be to meet with a trusted advisor to discuss all your options and set up a game plan. Meeting with a trusted advisor does not cost anything. Step 2 would be signing up for your A and B. And again, if you are already collecting Social Security 4 months before you turn 65, they will automatically enroll you. If you're wanting to start your A and B when you turn 65, you can do that at ssa.gov or at your local Social Security office. If you want to sign up after age 65, you will need a special form to prove you've had credible coverage that your employer would need to fill out and then send it to the Social Security office. Your trusted advisor could also help you with this step as well. Step 3 is getting your A and B card in the mail. It will come in a discreet envelope, so make sure you do not throw it away. The next step is to sign up for your plan, whether it's an Advantage plan, a supplement plan, with a drug plan, or a cost plan. Every year, there will be an open enrollment period. This is from October 15th through December 7th. This allows you to change your coverage every year if you wish. I personally send a letter to my clients telling them that we are approaching annual enrollment, and if they wish to give me a call to set up a time to review their plan, please do so. There is an additional enrollment period for people who are on Advantage plans from January 1st through March 31st. If you are on an Advantage plan and you would like to switch to a different Advantage plan at this time, you are able to do so. I always say suitability is key. Take into consideration your health, lifestyle, desired benefits, pharmacy, network, and costs when choosing the right plan for you. Here's an example. My friend Susie has this plan. I want that plan too. Well, that's great for Susie. But does Susie have the same income as you? Does Susie have the same doctor as you? Does Susie travel the same and as often as you do? There's so many different scenarios. There's not one plan that is right for everyone. Another thing we hear all the time, what do most people do? Do most people have Advantage plans or supplement plans? This slide was taken off Medicare.gov. They say about 32 million Americans have a Medicare Advantage plan, and about 12 million Americans have a supplement plan. Again, there's no wrong answer. Your advisor can help you decide which plan would be the best fit for you. Some Medicare FAQs and mistakes. Where should I get shingles, tetanus, diphtheria, pertussis, and other vaccines? Where should you get an annual physical versus a wellness visit? And which plan gives me them? Can I keep my doctor if I enroll in Medicare? I'm taking prescription drugs. What should I do? Will I have Medicare coverage during international or domestic travels? Should I pick a plan based on my dental, vision, and gym wishes or more heart attack and stroke? So what are the next steps? Your initial Medicare options should be considered carefully. The key is your needs, lifestyle, health, and many other aspects that go into providing the right advice to guide your decision. Educate yourself. Meet with a trusted advisor. I work with the top insurance carriers and have an unbiased opinion. I'd be happy to help you enroll in a plan. And please feel free to do any Medicare research at trusted sources. Every state has different Medicare rules and regulations. Here are some of the sites I would recommend. Thank you for taking the time to watch this video and get educated on Medicare. I'd be happy to meet with you in person and get all your questions answered. I can be reached at 507-208-3585.